Hello, good evening everyone. I am Dr. Saumik Chatterjee, consultant urologist and Uro oncosurgeon. Today I am going to discuss a few points about UTI or urinary tract infection. It's a very common thing and a lot of patients ask me questions about how it occurs, how to prevent it, how to treat it and how to make sure that it does not recur. So I am going to explain in layman's language what UTI is, how does it occur, what are the signs and symptoms, how to treat it, how to go about the complications, and how to adopt lifestyle or medications or various supplements so as to prevent its recurrence. Now, UTI or urinary tract infection is basically defined when you have symptoms like urinary urgency or frequency, you have pain, you have suprapubic or lower abdominal tenderness, you have fever, nausea, vomiting, back pain, any blood in urine, or very frequently passing urine in small amounts. This, when accompanied with a urine culture which reveals growth of organisms more than 1 lakh colonies per high power field, is defined as urinary tract infection. So before we go into the details, we have to know when do you go to a doctor. Suppose you have burning with urine which subsides say after an hour or so. It may not be UTI, it may just be a simple urethritis. For that you need not consult your doctor. But if you have persistent burnings with urine or pain or nausea, vomiting, blood, fever as mentioned by me earlier, then it is time to go and consult your doctor or your urologist immediately. So how to diagnose UTI? Now UTI is basically a spectrum. It can be a mild, simple UTI which gets cured within a few hours to a very severe life-threatening situation, especially in diabetic and in those patients who are in the ICU. The diagnosis most importantly is by giving a urine culture. So how to give a urine culture? The first is most important thing is that do not give the first sample in the morning when you get up. A lot of labs don't tell you about it, but you have to remember that the first sample is only when you want to diagnose TB. The second, third, fourth, any sample will do. Please clean your hands with soap and water. Clean your private parts also with soap and water. Retract the foreskin or separate the skin in females. Start passing urine. Let the initial few drops of urine pass off and fall into the pan. While you are passing urine, bring in the clean pot which the pathologist has given you. Collect the sample and then close it, and within an hour please deposit it in the lab. It should not be lying at your place in room temperature for more than 1 hour. If you give this sample, then it is called a properly collected clean intermittent sample. Make sure that you don't take any antibiotics before you give the urine sample for urine culture. Most importantly, once you give the urine culture, also make sure that a urine microscopy or routine is also done simultaneously, which will collaborate your reports. Apart from these, a few other investigations are also done to ascertain UTI and its severity. These include a total leukocyte count or a TLC, serum creatinine, and ultrasound with a PVR is often helpful, as is a uroflowmetry. Apart from these, other higher investigations can be done if your urologist feels they are necessary. Now, management or the treatment of UTI is basically based on antibiotics, which should be based strictly on the antibiogram or the culture report. These antibiotics should be given at a proper dose according to your weight and for a fixed duration only. Antibiotics are not to be taken for any period beyond those extended. Apart from these, other drugs such as bladder stabilizing agents and other medications to relieve the pain or bleeding can also be given. Some interventions like DJ stenting, percutaneous nephrostomy, and catheterization may be required in very severe cases or in critical cases. Coming to the management after the treatment of UTI, after your completion of medication and once you are symptom free, a repeat culture is required, which is to be done after 2 days after you have completed all antibiotics. So a 2-day holiday period is mandatory. This culture should be negative. In case this is positive, a definite search for the cause of UTI, for example obstructions, stones, any malignancies, any other cause, diabetes, etc., should be made, and this should be corrected, otherwise UTI will recur. In some patients, there is a requirement to give prophylactic antibiotics, for example nitrofurantoin or trimethoprim sulfamethoxazole, in those patients who have UTI in which frequency is more than 2 per 6 months or 3 in 1 year. Avoid treating UTI or avoid treating a urine culture, rather treat the patient. Suppose if someone gives a positive urine culture but is completely asymptomatic, that person doesn't require treatment. The only exceptions to this rule is pregnant women who always need a sterile culture, and in patients in whom a urological procedure or surgery has been planned. Another important thing to remember is how to prevent UTI. The most important thing is healthy lifestyle. Drink adequate quantity of water. Now what adequate means is a balanced amount of water, maybe 2 to 3 liters in rainy and winter seasons and 3 to 4 liters per 24 hours in the summer season. Excess of water is not good, and less water is also not good. Avoid alcohol, avoid all caffeinated drinks and soft drinks. Avoid the use of vaginal tampons and V-wash and other things which are artificial and which are actually not required. Avoid withholding urine. This is especially true for ladies who don't have access to a bathroom. They tend to withhold urine for 6 hours, 7 hours, 8 hours. And this actually is a precursor for not only urinary tract infection but also retention in the urine, which later leads to lots of complications. Avoid constipation. If you have constipation, you will have a difficulty in passing urine also, and this can lead to UTIs. Apart from these, the most important thing to remember is that UTI is a very common thing, very common in the elderly, very common in females. So it is important not to panic about it, but important is to treat it appropriately. Rampant, unsolicited and irrational use of antibiotics has made treatment of UTI more and more complicated. So whenever you have a UTI, don't just start with an antibiotic. First give a urine culture, consult a doctor, and take antibiotics only and only if it is required. I'll be updating you with further information as and when required. Thank you.